Welcome to the weekly dose of self-care presented by your neighborhood pharmacist. Today, we're going to talk about how to stop smoking in just 5 minutes. There are over 4,000 toxic substances inside cigarette smoke. But it is never too late to stop smoking. Just because 24 hours after quitting, your risk of heart attack starts to drop, then 5 years after quitting, your chance of having a stroke is the same as a non-smoker. Then 10 years after that, your chances of dying from cancer decreases by 50%. To start the journey of quitting smoking, you must first have the desire to want to quit and also have a quit date in mind. Now it's about managing your cravings as well as the withdrawal symptoms that peak within 72 hours after quitting and could also last a couple of weeks. The cravings are caused by nicotine that's found in cigarettes. Cravings are usually short-lived, so here's some tips to resist those cravings. Remember the 3 Ds: to drink, to distract, and to delay. Basically, it means to drink water if you have cravings, eat fruit, distract yourself by chewing on sugarless gums, and so on. If distraction don't work, then here are some nicotine replacement products to help with the cravings. We're going to talk about the gums as well as the patches. Just want to give you an idea of what cravings look like when you're not using anything. So these cravings are usually random, and sometimes it could be pretty strong such that you want to smoke again. But if you use the gums during those times when you're cravings, as you can see the black line, now things are all controlled. The other option is to use patches. So patches basically release a little bit of nicotine through our entire day. As you can see, now the cravings are much smaller than usual. Now you can just manage those cravings by distracting yourself. If those don't work, then you can manage the cravings by using the gums as well as patches together. Now you see the yellow line all flat. It is very important that you're using this Nicorette gum correctly because it is not like a chewing gum. If you're using like a chewing gum, you're gonna get a lot of bad side effects. So the way to use this gum properly is something called chew and park, which means you chew it once and then you get the flavor, then you park it to the side of the cheek, and you only repeat it when you have cravings or the flavor is gone. And to make sure you absorb the medication better, you have to avoid acidic beverages and drinks 15 minutes before and while chewing. Now each piece of gum will last roughly 30 minutes, after which you gotta throw it away. And once your cravings are controlled, you reduce it by 1 gum per week until the withdrawal is gone. But if you have any recent stroke or heart issues or jaw issues, then you cannot take this until you see the doctor. Now the gum comes in 2 different strengths, 4mg as well as 2mg. In terms of which one to use, it depends on how many cigarettes you smoke per day. If you smoke greater than 25 cigarettes, then you take 4mg. Now in this chart, it gives you a recommendation of how many gums you can use per day, but again, that's a recommendation, everybody's a bit different. The patches come in 3 different strengths, the step 1, step 2, and step 3, with the most at 21mg. So if you smoke greater than 10 cigarettes per day, then you can start on the step 1. But if you smoke less than that, or you weigh less than 45 kilograms, or heart issues, then you start with step 2. Now you'll be on the step 1 for 6 weeks, then move on to step 2 for 2 weeks, then step 3 for 2 weeks. Now if you're worried about people knowing that you're on patches for withdrawal, just keep in mind the patches are actually transparent, as you can see from the picture. Now here's some tips for using the patch. If you find that the patch doesn't stay on for the entire day, then before you put it on, use rubbing alcohol onto the skin first so the skin is more dry and it will adhere better to the patch. Next thing is, if you want to swim or shower with the patch on, that is fine as well. Now there is a common side effect of having nightmares when you use a patch. If you're finding that is an issue for you, then just take the patch off before sleeping. Now I want to show that the cost of these nicotine replacement products are not that more expensive than the cigarettes. Assuming $12.50 per pack of cigarettes, $31 for patch, $58 for gum, and looking at a 10-week course, that comes down to a patch cost of $310. But assuming you smoke a pack per day, that's going to be $875. Now if you were to use a gum on top of the patch, it's going to be $368, but it is still much less than $875. Here are some helplines if you need extra help. If you like what you're hearing, remember to like and subscribe and turn on notifications. Comment below if you want a video made on a certain topic. Otherwise, I will see you next Saturday at 8 p.m. Bye!